My name's Susan Price, and I'm the Deputy Director for Inclusion, Health and Wellbeing and Social Cohesion at the University Hospitals Birmingham. I'm also a critical care dietitian, and I also work in gastroenterology. So I first thought about becoming a dietitian when I was actually 15 and doing my GCSEs. I undertook the GCSE of domestic science and really enjoyed the theory, the nutrition part of it. On speaking to my mum, who was a nurse in the health service, she spoke to me about being a dietitian, and I was really fortunate that I was able to spend some work experience time in my two local hospitals, Ysbyty Gwynedd and Ysbyty Glenclwyd, and that really cemented for me the idea of me becoming a dietitian. So when I went to university to train to be a dietitian, I knew that I'd obviously had my chemistry A-level plus another science A-level. Well, it really took me by surprise, actually, how the first couple of years, there was a lot of biochemistry and a lot of physiology that did take me a bit by surprise. However, after being a dietitian and working in dietetics, I absolutely know why it's so important that we have to have that grounding of science for our course. So when I first decided that I wanted to become a dietitian, and actually during my university years, I was dead set on the fact that I wanted to work within paediatrics. However, my first role took me working within adults, and I have actually continued to work with adults throughout the whole of my dietetic career. I had a really inspirational senior dietitian who was working within critical care and gastroenterology, and I was able to do some work with her, and I became really interested in both of these areas, and that's where my clinical career has taken me. So for the last 10 years, I've had the role of being the head of dietetics within a large organisation. I've always really been interested in how we look after our staff within the NHS. There was an opportunity that came up for me to be able to become the deputy director, and I was really able to take those skills and knowledge that I have as a dietitian to be able to put those into practice, but working more with the staff within my organisation. I'm still very much a dietitian though. I still retain a clinical caseload, and I still really am very privileged that I'm able to influence patients on an individual basis as well. Every day, I genuinely see something new, learn something new, and I'm meeting new people every day. But also for me, it's the science behind nutrition and dietetics. Yes, we know a lot about nutrition, but there's also a lot of research that we need to do as well. And it really excites me that we've got that opportunity to continue learning. I'm incredibly privileged to have been asked to deliver the Elsie Widdowson Lecture for 2021. I really believe passionately that if we have an inclusive, diverse workforce, then we will be able to deliver better quality and safer patient and client care. If our staff feel valued, if they know that we want them to be here within our workforce, then they're going to be able to deliver better care to our patients.